Good day to everyone. It's different times of different parts of APFHRM. So in the traditional Sri Lankan way, I would say, Ayubowan, may you have long life. This greeting is more relevant than any other time in the COVID-19 pandemic because we are all concerned about our health. We are all concerned about our wellness. We are all concerned about our future. So therefore, we are creating history by having the first ever webinar by Asia Pacific Federation of Human Resource Management, covering the entire region, being the humanly rich region in the world, the most humanly rich region in the world. So we are going to talk about the precious resource in any organization. The only resource that can take command and control over the other resources. So I'm referring to human resources. So we have something in common, irrespective of which country we belong to. We all cater for people. We all work with people. We all want to get the right results through people, with people. And in order to move ahead with them, with right engagement, in order to have right excellence. So we are all faced with this challenging situation. Perhaps we are in the middle of the World War III. Only difference is first two world wars were battled among nations. People clashed with one another. Here it's people versus nature. Nature has given us the simple message that we have to take nature seriously. As the Red Indian head Seattle said, nature does not belong to us, we belong to the nature. So with that backdrop, we are here to discuss HR challenges in post-COVID-19 pandemic. So I'm very happy to welcome my fellow panelists and also all the wonderful participants from different countries in Asia Pacific region. So to give a brief welcome and also to share the perspective from a CEO and from a president's point of view, and to ensure that we have the right setting. So may I invite the President-elect of Asia Pacific Federation of Human Resource Management, Mr. Dhammika Fernando, who is also the President of Chartered Institute of Personnel Management, Sri Lanka. Over to you, Dhammika. Dhammika, over to you.
Sometimes you forget to unmute. Sorry. Thank you, Ajanta, and thank you, everyone, my fellow panelists, my fellow people managers and people professionals from the Asia Pacific region. So if and also welcome to all the audience here with us today to take part in this important webinar about post-COVID challenges of the Asia Pacific region. And I give you a brief introduction of what is APFHRM, is that Asia Pacific Federation of the Human Resource Management Associations, and this is the continental body out of 5 continental bodies, which forms the apex body of the World Federation of People Management Associations. And currently, the APFHRM region has consists of 17 countries. If I may briefly say, starting from the Oceania, Australia, New Zealand, Papua New Guinea, Fiji, and also Vietnam, and from the other side, Japan, Hong Kong, Singapore, Malaysia, then from the Southeast Asia, India, Bangladesh, Pakistan, Sri Lanka, Maldives, and I wonder if I've forgotten any other country, Rose. No. Okay, right. So been existence for about a couple of decades now, and we've been serving the people profession in this region for many years. This is one of the most important and resourceful gathering of people professionals in this region. So if I to proceed, let me just share my screen sharing. Can I host disables participant screen sharing? Can the host enables my screen sharing, please?
CIPM IT team, I'm sure you will do that.
In the meantime, I think during this situation, I think I would like to commend and appreciate some of the countries in our Asia Pacific region are in the forefront of managing this COVID emergency. Actually, some of the countries belongs to our APFHRM association also, especially Taiwan, Vietnam, New Zealand, and South Korea. These are some of the countries that are in the forefront at the moment in properly addressing and managing this situation. I hope that now, yes, here. Okay. Yeah. So to get on to our discussion, the country situation right now, it's actually as at last evening in Sri Lanka currently total confirmed cases 824 and 9 deaths, and also recoveries 240. There are another suspected cases of 135, and currently this is the curve that we are having, and in Sri Lanka. So yesterday there were no cases reported actually, and then when it comes to the country challenges. We have also our fair share of challenges at the moment. I'm not actually currently talking about the HR challenges, but in general, as Sri Lanka, the challenges that we are facing is actually, to tell you, first thing is that it is a real dilemma to find out who is the real enemy in this situation. Is it COVID-19 or is it the curfew or lockdown currently that we are facing? Because we really have to understand the economic realities as well, in the sense what is more important and prioritized when we go on and addressing the situation. Yes, true. The people are the most important when we are talking about this health emergency. We have to save people's lives. Then there has to be some kind of the trade-off between the health impact and also the economic impact. Actually, as you can see that, I think all around the world, the percentage deaths or the if we may take, it's about maybe around okay, talk about the situation in Sri Lanka, it's less than even 2%. So we'll have to find out what it is really, because people are going to health emergencies. We have different other epidemics also in our countries, and how we are facing those. And is COVID really different from those? And then only we'll have to address the next, that is the economic realities or the economic impact of this kind of situation. So another dilemma which we'll have to identify who the real enemy is. And actually the COVID was the second wave for Sri Lankan. Our economists economic slump because, as you may remember, during last April, the 21st of April, Easter Sunday, we had a devastating terrorist attack on completely had to, we were maybe I mean our economy was hampered, in terms of tourism. And then not only tourism and allied industries also has suffered, and therefore the economic slump. And then next comes this COVID. And inflation and growth dip due to cessation of these economic activities as economics that we'll have to find out how really the COVID is impacted our economy in time to come. In another few weeks time, we can come out with some figures. Well then, the proposed economic revival model at the moment, I don't know whether it is really the final solution, but currently which is on the cards are a bit of ambiguous proposals, because how best and how fast as the currently some of the economists and some of the government officers are proposing about the sustainable growth through agriculture-based revival. These are also some things which are questionable. And then probably you may all know, or you may not know, the foreign participants, that in Sri Lanka we have one of the most archaic and draconian labor laws which prevents employers from certain agile and flexible practices. Also, which is heavily skewed towards employees. And then the service industry, which is led mostly and predominantly by tourism. It is predicted that it can suffer by about 4 to 5 billion US dollars, and which is a double blow, and consider Easter Sunday attack. And then export manufacturing, which is again predominantly led by the apparel industry, that which will suffer by about 1.5 billion US dollars currently, which is predicted. Then again, as one of the saddest thing is that unlike in the West or United States or any other Western nation or the developed nation, that Sri Lanka do not have that much of a robust social security system per se for in case of employees, when they lose jobs. So that is one of the main concerns of people, professionals in Sri Lanka nowadays. Again, I must say that it is I have repeated it, extraordinary rigid labor legislation. Then, what are the people challenges in the world of work as far as Sri Lanka is concerned? First and foremost, it is the lack of clarity and direction in the legal framework. Why I say that? Because when it comes to a situation like this, a pandemic situation, and where you have lockdown and curfews, kind of a lengthy curfew situation, the laws are silent. The laws do not, especially the labor laws, do not prescribe or assure that these are the kind of measures that the employer or the employee can take. And there you do not have clarity and direction for our people managers or the people professionals to follow. So there you have a huge dilemma. And then the government and the politicians are also taking a kind of a political approach where the authorities are concerned, uh, when it comes to the private sector or even for that matter any other sectors, people decisions are concerned, that they are taking a kind of a political approach, which doesn't help either employee, neither employee nor the employer. And then the companies are mostly, the Sri Lankan economy is predominantly supported by SMEs, that is the small and medium scale industries. So those SMEs, some are going out of business, mainly due to working capital and cash flow issues. So what can be, how can the people professionals uh, address these challenges is another matter of concern. And remote work facilitation, modalities, culture change, and security. When I say security, that is about the data security and plus the domestic issues, because the Sri Lankan white collar workers so far have not, by and large, not got used to working from home or remote work. So they had to get adapted to it, and still they are in the process. And the people managers need to help in this and facilitate this work. Then again, as you all understand, in all of, it is common to all our countries about the well-being, worker well-being, and then they are returned to work, and certain moral issues, and how are we going to welcome back the employees back to work, if at all they are coming to work, and the way that we treat the employees. Uh, then again, the leave matters and pay issues, and some word that we've never used and heard of about following, and the work shifts. How do we arrange work shifts? Because we know for a considerable amount of time that we may not be um, able to work with work full swing. I mean, with 100% of our workforce. We need to arrange some kind of arrangements with the alternate days work or work shifts or something like that. And these we need, rather what is the cost involved in such arrangements, and then find out with our CEOs. And health and safety measures need to be taken. Then I come to that point which I've talked about, is the additional employee costs, because you need to have additional sanitary measures. Then what about the data costs, remote work arrangement costs? These things are some of the things that our people managers, people professionals need to address. Then performance measures. How we are going to measure or see what is their contribution, how have they contributed to the work, and what is the bottom line, and whether they are work from home. Especially, I'm talking about the work from home when I'm talking here about the performance measures. And then the trust factors. Actually, we need to have some kind of a trust among employees and the employer, as far as the performance measures. Working remote work, as far as the remote work is concerned. And then how are we going to adopt lean practices? Are we going to have the same hierarchies? Or whether we are going to work different, cross-functional work teams, like CIPM have started recently doing. Likewise, there are these issues as far as the employee performance are concerned that we need to address too. And then this is one of the very important and sad part, is that some of the, not only the young people managers, young people professionals, that they lack knowledge and industry experience, and I would say amateurism of people managers and trainers in talking about these current issues and in acting upon the current issues. So this will, certainly hamper the development development and hamper smooth functioning of organizations, because people get mixed signals and things like that, because we have to have some kind of a uniform way in addressing each and every issue. Overreacting to the situation, because in here, when it comes to our media, I would say the mainstream media, they are publishing, today, tomorrow, and next day, where and how and who contracted the COVID, the virus and all sorts of things. And these are really not very ethical in my measures. So the kind of social stigma which is created, and the fear psychosis. These are some other things that employers and especially the people professionals need to address. So this is my last slide. I would say that how we can overcome this situation. And actually, this is the time for us. This is the time for the people professionals, because they have come to the front line. They are like the health officers and in our countries, the law enforcement authorities are the front line in battling COVID. And similarly, in the work front, in the world of work, people professionals are the front line in battling this COVID aftermath. So they need to get prepared, and they will come to limelight, because they are the front line, and everything in an organization depends on how they react to the situation, how they proactively attend to these kind of situations of the COVID aftermath. Therefore, it is very important that this is the time for the people professionals. As when I was participating at the World Federation webinar, I remember that the CEO of HRM, Mr. Johnny Tyler, yes, Mr. Johnny Tyler is telling that for a very long time, people professionals have been clamoring for that seat at the proverbial table. Now that it is been provided, it's been given to you all. So how are we going to perform? How are we going to take charge of the situation will matter in the future for the profession. And then the leadership in all aspects of people side of the organization will be the game changer. How the people managers address, how the people managers will, it will all be reflect upon the future of the profession. That will be probably the game changer in my word. I always take decisions thinking of the human dimension of work. That is very much important when you are taking decisions in this time of in this situation that we are all facing, because this is, as we all always are telling like a mantra, it is unprecedented, and we never knew that what it is, and we are still doing trial and error, and we are addressing situations as and when it happens. So it is new to everyone. Therefore, we need to be thinking people-centric, and then creating a supportive work environment at a home office. And is again one of the important things, because how you create, how you support an employee for them to have a work environment at home. It is not easy as working from home or office. Working from home has many challenges to address. And also the psychological and health and safety of workers. We need to have certain assurances to be given, and influencing governments and policy making authorities. This is one of the important things for us right now, because we need to show that this is the way we have to provide the leadership. When governments and policy-making authorities are taking employee health and safety and pay policy decisions, working hour decisions, and especially about communication, etc. So the other matter is for in time to come, or rather we'll have to act upon it right now, is upskilling, reskilling, and multi-skilling. Because we never know that we'll have to find out whether our organization will diversify or will do completely different business tomorrow. So how we are, standing up to it, and how we are going to change, and how we support the organization in that change. These are some of the things that we need to look into, because the employees may not be or will not be doing the same things that they've been doing previously when it comes to the when it situation normalizes. So these are the things that we need to address in uh, and also we have to take care of our HR staff, our own people, because they are the front line, as I said, but because they will have a lot of pressures, and they will have as well as other workers, maybe more than other workers, about the well-being matters. We need to look at their psychological health as well. And then finally, what I want to advocate is these are some of the key things which these days all people professionals need to have in their prayer books: agility, adaptability, resilience, communication, and empathy. So communication, I must say that, which is very, very important these days, because your communication has to always be precise, clear, and simple. It needs to be driven to the employee the way that you perceive as to go to the employee as well. So agility, I don't need to say that agility and adaptability, because adaptability is the key word when it comes to work environments and world of work these days. So thank you very much, and I hope that Ajanta take it over.
Thank you, Dhammika, for that very comprehensive and detailed description about Sri Lankan situation in first, then the HR professionals in general, what we need to do. I captured one keyword: communication. Communicate, 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 in upskilling, multi-skilling, and reskilling. So with that insights, let me move to Rosemary Gad from Australia. So Rosemary, it's up to you to describe the Australian scenario for the benefit of APFHRM. And I see some participants from Africa and outside APFHRM also. They have joined the webinar. That's a very encouraging sign. So it has become truly a global webinar with a lot of representation even outside APFHRM. So over to you, Rosemary.
Professor Janta, thanks to Dhammika and CIPM Sri Lanka for setting up and hosting this webinar tonight. I'm going to go through a few slides, but I'll try and go fairly quickly, and I'll just ask for the thank you very much. So just to give you a quick snapshot of what does Australia look like currently in relation to COVID-19. As you can see, we are on the downward curve, but our total number of cases, 6,833, and overnight, over the last day, there was an increase of 18. So there still definitely are cases around. They are limited to 2 or 3 states of Australia and to a couple of particular hotspots. And we've had 93 deaths and 6,035 who have recovered. We are currently still in level 3, so we are still in lockdown. If you'd like to go to the next slide. So just by a little bit of background, the way that the Australian government has approached the management of the pandemic is to create a national cabinet. And so the Prime Minister and the state premiers and their chief medical officers have formed a national cabinet. So that's meant that it has been across political parties, which is really for the first time that they've operated in this way. As of yesterday, the Prime Minister has now announced a pathway out of the lockdown. And these 3 steps should progress between now and July, but each state will be able to choose the timing of moving into step 1, step 2, step 3. So next Monday, the state premiers will start announcing their particular plans. But it's interesting to note that, you know, potentially from next week, people will be able to start having visitors at home. They will be able to have 10 people in a business or in a public place. People will be told that they can continue to work from home if it works for them and their employer. And currently, a large proportion of the Australian workforce is working from home and working from home quite successfully. Restaurants, cafes and shops will start to open. At the moment, all restaurants and cafes are closed. So you can see the stages up into step 3. They hope that by the end of July, we'll have gathering sizes increased to about 100 people. Weddings and funerals will still be limited to somewhere between 20 and 30 people. And we would start seeing by July a greater return to the workplace. So these stages are clearly about kickstarting the economy, while also maintaining a high focus on health and safety through maintaining the physical distancing of 1.5 metres, continued focus on maintaining hand hygiene, respiratory hygiene. There will be much greater focus on employees staying at home when they're sick. I'll share in a little bit the COVID Safe app, which is a tracking. We'll just stay back on that other slide for a moment, thanks. The government has just implemented a tracking app, and currently 5 million Australians have actually downloaded this app. So they hope that this will be a really important part of managing the tracking and limiting the spread of COVID once people start moving back into the workplace. Continued population testing and focus on health and safety. From a workplace and workforce perspective, at the Australian HR Institute, we recently surveyed, we've surveyed our members twice now over the period of COVID-19, and these are some of the priorities that they've shared with us. So as we now start now contemplating what does return to the workplace look like, there's this notion of defining what is the new normal. What will the workplace look like and feel like as we start progressing back into the office or into the workplace in larger numbers. There's certainly a priority right now for many employers is planning a return to the workplace, but in the context of maintaining physical distancing. At ARI, we've started our own consultation, and employers really are being encouraged to engage and consult their employees in what the best solution might look like. Very conscious that the priority has to be around employee health and safety, both physical and psychological. And clearly when many employees have been working at home for the last 7, 8 or 9 weeks, some are very ready to come back in. Employees to work remotely, and that has resulted in improved use of technology and improved access of technology. That will now continue. We're not going to go backwards on that. Every organisation. So while most companies, most employers have had flexible work arrangements, they have now been, if you could just stay back on that slide, thank you. The flexible work arrangements have really been tested, and if you could just go back to the previous slide, that would be helpful. But what we see now is there's a much greater acceptance of flexible work arrangements. They are actually working. Managers are less concerned about productivity because, in fact, productivity in many cases has actually gone up. And everyone is much more conscious of good hygiene practices. That's not going to go away. And I think there will be much greater concern about people who are sick coming into the office. So we see some shifts there that we think will stay in the future. There's now also a greater, we need to be even more focused about employee wellbeing, both mental and physical, and very conscious that longer periods in lockdown, concern about family and relatives being infected, with schools being closed, families are educating their children at home. So there's quite a new dimension around considering employees' well-being. And surrounding all of that is managing the impact of business downturn. And clearly that's a high priority focus area for HR. And then alongside all of that is how do we re-engage the workforce while continuing to work remotely, but also in whatever this new normal looks like. On the right, this is a survey that we ran, and just the issues that our members, mostly HR professionals, are mostly focused on, mostly concerned about is reintegrating staff into the workplace, loss of revenue, downturn in business, people continue to work from home, further government restrictions, and remote working. So these are some of the challenges that HR are clearly focused on at the moment. The next slide, thank you. And my last slide is just a snapshot of what is some of the, what's sort of been in the media in the last week in Australia. In the top left, there's a far greater awareness of the fact that with people not driving into the cities, with people not travelling interstate, with no cruise liners coming into our beaches and coasts, the environment has definitely been improved. Pollution is well down, traffic congestion is down, beaches are cleaner. And so people are looking at this as really this is now an opportunity to reset our environmental future, and one that employers really need to also have front of mind. The bottom left, the fallout, like everywhere, is that there's a large proportion of the workforce who have lost their jobs or fear that they will lose their jobs. We are very fortunate in Australia to have a very good social security safety net, but still there have been big job losses. I mentioned the COVID Safe app. So this is the government. This is the tracking app that the government have just launched, and encouraging all of us to download. There have been plenty of privacy discussion around this, but people also really understand that this could be a way of enabling people to come back into the city and back into the offices. Transport is a big issue. One of the concerns for a lot of employees is their commuting on busy transport, busy trains, very full trains and congested trains, and will now have a concern about getting onto public transport. So what does that look like? And the last one, I guess it's appropriate. We are on a Zoom conference. Many of us are spending many hours a day on Zoom meetings. It's fantastic technology, but there's also a sense of Zoom fatigue. So how do we manage our communications in this new world? So I look forward to discussing and learning from some of the other countries about their experience. But thank you, Ajanta.
Thank you, Rosemary, for those wonderful, insightful sharing of information. I like the way you mentioned about your government's approach as purpose-driven rather than politically divisive. And that could be a good lesson for many other countries to have that common purpose, and the smart way of having smart apps to get the general public being aware of the gravity of the situation, and so on and so forth. Okay, so it's my turn now to invite Mr. Arisandan Naidu, representing Malaysia. So tell us about the Malaysian scenario. Over to you, Ari.
Ari needs to unmute.
You need to unmute. Yes, now it's fine.
Okay, firstly, my appreciation to CIPM Sri Lanka, Professor Jenta, Ms. Ray and Mr. Doeka Kando for hosting this platform for some thought sharing on the pandemic COVID-19 in the people management arena. My sincere greetings to all HR professionals in Asia Pacific. Please keep your cool during this period, including all HR professionals in my home country, Malaysia. All of you are doing the best in your functions, and please keep it up as the changing demands on the profession will become greater and greater as long as the COVID-19 pandemic continues to threaten nations alike. Next, moving to the overview of the situation in Malaysia, let me itemize it into two aspects. Firstly, the government measures, and secondly, the HR scenario. Now, on the government measures, generally, like all other nations, the government led by the Prime Minister took a concerned responsibility in controlling the spread of the virus through various safety measures universally done to protect the citizens, business, employment, and growth. Now, within this context on government measures, some highlights we note are, which we are proud of. One, the government is aware of the pandemic since early January of the year and prepared its machineries involving the various ministries to create awareness and preparedness to protect and control the spread. And some of the ministries did exceptional jobs, and Ministry of Health received a high praise for their role in this task. Now, after 2 months of awareness and preparedness, the government imposed a movement control order on 18th March 2020, wherein all movement of people was restricted, with only industries in essential service in operation, and also with 50% manning. And strict enforcement nationwide by police, and all measures followed. Now, during this period, government also introduced the stimulus package to support the industry's citizens during the difficult times, with greater emphasis on the small and medium industries and low-wage earners. Now, since 4th May 2020, last week, after 47 days of strict movement control order, the government is beginning to ease the movement control order by allowing more businesses to be open in stages to protect, most important, business, employment, and this goes along with the new COVID cases reported decreasing on the daily basis. Now, next let's look at on the people management scenario. Now, based on the government measures and all these laws, guidelines, and information set by the various ministries, and added information from the global arena on this pandemic, the professionals had to implement heavy responsibilities, all these precautionary measures in the organization. Measures were undertaken to organize work from home for those in non-essential industries and in the essential services to ensure work is done safely. To get all this done may look simple, but when the task was undertaken, the professionals felt the challenges were seen to be too many and also greater based on the complexity of the industries and business and the individual job tasks. We could say every professionals are having their own unique experiences and challenges. Let me highlight some notable features seen in the scenario of the HR professionals without going into the details of the nitty-gritty. There are 5 areas of observance. One, primarily, it is observed that COVID pandemic caused every HR professional to go beyond in their roles and functions. There was a higher demand and pressure on them to lead their teams and organizations with sound knowledge on the issue. Point 2, there was demand on them for greater execution skills, problem solving, risk taking, decision making, and so on, putting a daily pressure in the profession which could not have been seen on the normal business day. Third, the profession and the industries saw a sudden urgent need for greater application of IT tools and AI, etc., in every aspect of the functions and operations. Fourthly, what was impressed in my nation was the national teamwork. Never seen before, and this was happening, where the entire industry of professionals from different expertise came together in many different platforms on social media to share and provide solutions on a timely basis to ensure a balance is found between business and employment, though painful decisions such as pay cuts, termination, and retrenchment was on the table. Next, on the relationship, there are two aspects to share. One, some of the professionals in the essential services, perhaps it also apply in other areas, expressed that their relationship with employees was more rewarding and enriching, and they found a new joy in their job. I'm sure many would have discovered many other new joys in their job not found before. Now, lastly, the pain on the job, which is rarely highlighted. This is a story of a HR head. This particular HR head was in charge of a medium industry with a workforce of 250 people. Business was down, and in the last 2 months, the HR head did all the measures to protect the business, including all the activities that HR does. Then last week, the HR head received a retrenchment letter from the director of operations. Well, this is a pain on the job, but there could be other new pains on the job that HR professionals would like to share. With the word brief on government measures and the simple scenario on the profession, without going into any technicalities and detailed operation aspects, which HR are common to us, and business be subject to global, regional, national policies, which continue to be uncertain, we pray and hope for growth. Thank you, Chairman, for the opportunity. I'm sure professionals in my country will share greater things.
Thank you, Ari, for that wonderful sharing about promises and pitfalls, a mixed scenario coming from Malaysia. So interesting insights. So let me now turn to Mrs. Rosie Fong from Fiji and to share the Fijian experience, how to tackle COVID-19 pandemic from a HR professional's point of view. Over to you, Rosie.
Thank you, host, and thank you, Professor Janta. And welcome everyone that's listening about Fiji. I'll be very quick. First of all, I must start my statement by thanking our Honorable Prime Minister, who has been leading our country from day one on COVID-19, the controls, our Minister for Health. The health professionals can never go unrecognized. A big vinakabakaleu to all our health professionals in Fiji, and they've done a fantastic job of containing the COVID-19. Fiji actually, unlike the global, where over 110,000 were confirmed cases in 173 countries, the unprecedented situation globally of COVID-19 shocked everyone, including Fiji. Fiji had so far had no losses for death. We had around 18 confirmed cases. We now have around 4 left. It was very well contained in our country. Yes, the borders are shut. People are working from home. There's sadly, our main impact to our economy is our tourism industry. So talking about the Fiji government that went into action and put in place a team that went out looking at people across the country. We had a response, COVID-19 response budget that came out very quickly in the country to help everyone, including businesses and individuals. The Ministry of Health and the medical services were fortunate that their teams were ready to identify and isolate quickly the cases of the virus outbreak. It was a good approach Fiji took when the COVID-19 started across the world. We had lockdowns, we had closures, we had restricted movements, we had social distancing, we have curfews going on at the moment. And yes, it has impacted our economy greatly because we have the tourism industry, most of the hotels are on lockdown at the moment. As you would know, there's no one traveling into the country. So that has impacted us in Fiji. The security is strong in the country. We have help from the military as well. They are working in partner with the Ministry of Health and the people. We have the media that is also out there. Every day we are telecasting and educating our people, continue with health and hygiene, continue with social distancing. Although Fiji may not be in the situation that our global partners are, we still have to remain very, very cautious. Our first case of COVID-19 came from one of our crews that was in the US, and it came into Fiji. I think whilst the employer was guiding them to take cautions and be cautioned, our people took it very lightly, and so he went out, he did not practice isolation, and so it actually spread. So that was said. Anyway, leaving that aside, our country right now is really well contained, has put in a lot of logistics, a lot of measures it has put in place, and it has affected our GDP, of course, yes, like every other country, but we're hoping that we'll quickly bounce back. Not very soon, but in the near future, that's for sure. With the lockdowns and curfews in place in Fiji still, there is now not any area that is under lockdown. Most of them, we isolate them like for 28 days and all. So the containment is pretty good in Fiji, I must say. Wherever possible, the supermarkets are maintaining the social distancing. They're allowing people to stand far apart, 1.5 meters. The banks are very cautious of that. So during the COVID-19 Fiji experience, the essential service workers were up and working. And the health people, again, I must say that the health people out there who did a phenomenal job in Fiji, round the clock, making sure across the country, they were testing, fever clinics were up. A lot of work was being done to make sure that, you know, a country like ours, small population, that COVID doesn't spread and affect us. So that was good. Also, we have the impact in business for small restaurants. The restaurants are really losing our business because people are not going out to eat as much. Purchasing items, there was no panic in Fiji. Maybe on the first day when people heard about COVID-19, they started, but I think our supermarkets are well equipped. We're not facing any of those items, are not short. The hand sanitizers, we've had organizations that come up and have contributed towards the public, you know, putting out hand sanitizers and letting people ensure that safety and health hygiene is also top priority in the country. So I must say that the current situation we have at the moment with the budget that was given out, our country, as you know, there are people that have lost their jobs at the moment in the hotel industry, in other industries that link into these sort of businesses. So people are being assisted by our government as well. People are taking out some funds from the superannuation. And those that can't, the government is also contributing towards that. It has helped employers in terms of reducing a bit of their contribution towards the Fiji National Provident Fund so that it gives back some money to the employers. So from a mandatory contribution of 10%, it has come down to 5% for the companies. And with the money that they may be saving for the next 6 months till December, they could be using it within their companies and assisting staff, people, assisting the welfare of the people. People are working from home, you know. So kind of give back in that sense and do that. The other thing is our government had given the medical services a good budget to also ensure that they were able to go out and work amongst all the communities in our country and help for that. So in brief, I know we are short in time. Fiji is doing well in terms of containing COVID-19. Organizations are challenged with businesses are slow. We can see the impact happening in some organizations, mainly the tourism industry, the airline industry, probably the construction industry. There's less of imports coming in. Things like that is being impacted. When that happens, then of course it affects the staff, the people in these industries. And so some organizations, staff have taken the annual leave, some have gone on leave without pay, and I think Damika covered very well those topics, which I had also noted, so I won't repeat myself there. But the main thing here for us is right now, we have things that's open, so people have returned to work. However, the social gathering is still must contain 20 people, although that's open to people that you can go out and have social gathering. Physical distancing must happen. There's no two ways about that. Daily hygiene, daily washing of hands, daily talks on telecast. People are being reminded about that here. We've had a survey through our Fiji Human Resource Institute. We have conducted a survey on COVID-19. Sorry, I could have shared that slide, but maybe later on I would email the slides to you. We'll have our manager do that. Fiji right now also is working with Australia and New Zealand. I mean, the government is talking about that, about this travel bubble that they're trying to open up between Australia and New Zealand. And if Fiji could also contribute to that, and also the Pacific, to allow visitors travel, so it could help our economy in the tourism sector. So we're working closely, the government is working closely with Australia and New Zealand to see if we can join in that travel bubble. So that's a good thing happening. On the other side, the people that are traveling, they have to be cautious in public transports, they have to maintain their social distancing, and things like that is very strongly happening here. I must say we are blessed. Our country is blessed that we have not had any losses. As Rosemary mentioned, as for Australia's statistics, they had some deaths, and of course, yes, globally, there has been other countries that has had a lot of losses. So the main thing in Fiji with the COVID-19 was to save lives, stay safe and save lives. On the HR side of things, if I may just add to that, Ajanta, this is my opportunity to talk on a bit of things from a HR perspective.
Yes, yes.
If the way we look at our human resources in the country, I think there was a lot of learning for us in Fiji, because we're not like the other countries where people would work from home, because our social impact in Fiji is people go to work, they travel to work, they don't stay at home and work from home. But this COVID-19 gave us many people work from home. Government even allowed people to work from home, our organizations. I work for HFC Bank, and yes, we had teams working from home, especially if they were in lockdown. So that was a great learning for our country. That was one. And the other thing is technology. In Fiji, people working from home, the infrastructure, thank God we had some of those, and it was easy for people to work from home. The informal sector is being affected. So from a HR perspective, the loss of jobs is out there. People have been sent on leave without pay, which is impacting. So the Ministry of Employment is handling some of these cases where employers have sent some people home, but for the survival of the company, I suppose, for the short term. But many of them are continuing to pay their people. The other thing I would like to say from a HR perspective that has emerged strongly from COVID-19 crisis is that the companies should start learning from this. Whilst they weren't affected, we have lost jobs, we have lost people, so we will lose skills. So again, that was covered by reskilling people, upskilling people, and the workforce now. That to me is very important to all HR practitioners. Adapting employee skills and roles in the post-pandemic is a way of working, and that is so crucial to the business. especially going forward. So all companies will need to sort of look at the business operating model, you know, and such pandemic was just not planned for, I suppose. And so what has happened, loss of skills, people having to work from home, salespeople not going out to people, but doing sales digitally, you know, going through electronic means, is a change in people's occupation and style and roles. So obviously, from a HR perspective, if we all recall, some time back, we were talking, a couple of years, we were talking about how roles will change, how occupations will switch, and how we will need to acquire new skills because of automation and because of artificial intelligence. We were talking about that not very far. So the coronavirus pandemic has made it even more urgent for us as HR practitioners to realize now that the organizations must be able to adapt quickly to the rapidly changing conditions. And we must be able to learn to match our workers, our employers, to these sort of roles and activities, you know. I mean, workers are working from home. Children are in Fiji. All our schools are closed right now, and they're open around early June. So we've gone education to kids at home through digital means. Everyone's got workbooks. Parents are helping children study at home. Teachers are still connected with parents. So that hasn't been a major change. I mean, no one ever thought that would happen in Fiji. But again, the impact on this pandemic has forced people to do sort of these new things in the workplace, even around the societies, you know, and who knew this was coming? Again, I must wish to say that we need to adapt to these changing conditions, and we need to learn how to match our employees, how to support our employees in the activities and in the roles and in the situation that they will. So as leaders in HR, and this was mentioned earlier by our learned speakers and panelists as well, that this is the time to reskill and upskill the workforce to deliver new business models post-pandemic. So when we talk about that, we say, how do we do this challenge? I would like to focus on one thing, and that is craft the talent strategy. I think we're talking about HR here. We have people in the workforce, and talent is the most important thing. So whilst people will look at business, we HR practitioners will look at our talent strategy and develop the employees in terms of change in the workplace, critical changes such as going digital, you know, having the capabilities to adapt, be resilient, look at the environmental impact, people doing sales instead of going door to door, social distancing, how can they do sales, etc. We've talked about remote working from home. Companies, for Fiji, it is something new for our companies to start looking at people working from home, how will they be productive? So as HR practitioners, as leaders in the workplace, how do we lead our teams? How do we manage our teams? You know, managing teams virtually is going to be a challenge for some. I mean, no coffee chat meetings, right? No meetings on the corridors or whatever. You walk in the office and you book a meeting room. So now you have to have virtual meetings. I mean, I share an experience. We had to have our leadership meeting and we had to use like 2 or 3 rooms so that social distancing is maintained at the workplace, and you have to Zoom in and have your meeting still. So that was all virtual. So from a HR perspective, those are the important things that I wanted to share, given in the interest of time. So we have to really quickly work and adapt certain approaches and create the best in our people best in the learning of our people and how we can have and support the sustainability of businesses. And I only pray that all the countries will bounce back. And for our country, Fiji, our hotel workers, which is really a large number, as you know, Fiji is so well known, such a beautiful paradise. No one's traveling into our country right now, and we have the best shores. So that's impacted our people greatly in there. The airlines are impacted. There are other businesses in the West and all over the country is impacted, and we pray that it will sort of bounce back. Thank you, Ajanta. Chair, that's all I have to mention about, from a HR perspective, the challenges we face in Fiji with COVID-19. Our country is blessed. We continue to be blessed. We had 18 cases. We have 4 currently in isolation, being very strongly monitored. Having said that, the Minister of Health, our Honorable Prime Minister, and many others, the health workers, are still all working to make sure that COVID-19 is contained in our country. Vinaka.
Yes. Thank you very much, Rosie, for that very enthusiastic way of sharing ideas, showing the pressure and the pleasure of being a people practitioner.
Thank you.
So with that, let me move to my neighboring friend, Mr. Vishwesh Kulkarni from India. Vishwesh, could you tell us about the Indian scenario?
Good afternoon.
Good afternoon.
Very great initiative, APFHRM, CIPM. Great job, Ajanta and Dhammika. Thanks for the opportunity. Presently, India is having around 60,000 positive cases. Till date, more than 18,000 cases got cured very well. Death toll is around 2,000. Major affected states in India are a couple of states like Maharashtra, from where I belong to. Then the state like Gujarat, Rajasthan, Delhi, Tamil Nadu, and Telangana. But the states like Kerala and the Northeast region, they have done very well, and they have come out of the pseudo issue of this corona, and they started doing well. The major concern we have is the Mumbai. Mumbai is we all know that the capital of the economic capital of India, which is suffering like anything, more than 15,000 cases, and the expected spread is much larger. I think that is the concern for India, and we are all taking care for that. The major aspect is that we all being in a young nation, so the immunity power was good, and that way compared to the population, I would say that India is much saved as far as spread is concerned as on date. The very well timely action by Prime Minister Narendra Modi ji to lockdown. We have lockdown for now. Today is almost 45th day we are in the lockdown. The lockdown was twice extended, and I would like to say that the people have supported. Most importantly, all the people came together and they supported. But the impact in the economy, which will be very higher side, the growth rate, which was 6 to 7%, now it is projected that negative growth rate will be there. Sectors like automobile, software, textile, aviation, hospitality, tourism, retail, and banking are worstly affected sectors. Some of the sectors like automobile may take minimum 2 to 3 years to come up to the pre-COVID stage. Similarly, aviation, tourism, and hotel industry will have huge impact, and it will take years to recover the same. Such situation will definitely lead to collapse of economy, increase in unemployment, and it is also predicted that crime rate will also increase as the time goes by. Some of the initiatives taken by the central government and the state governments, the creation of Arogya Setu app. For all the people in India, the central government has developed the app which you can understand what presently the status is, where you are located, how many cases are there nearby, and you can protect yourself. The state like Karnataka, they have given 5,000 rupees to each of the self-employed entrepreneurs, small entrepreneurs. They gave 25,000 rupees per hectare to the small farmers. The Provident Fund Department came forward and they gave 75% of the amount equivalent to the 3 months of the salary to the people to survive from such kind of a thing. The central government has deferred the EMI and monitoring period by 3 months. Payment of GST, which is we have the goods and service tax as a tax, the central government is deferred by 3 months. For the below poverty line, the central government is giving the free ration for 3 months. I think these are some of the steps which are taken by the central and state government. And we all are expecting that with the issues what the worldwide China is having now, most of the manufacturing setup would like to shift from the China. And we are hoping India is one of the best options for them, as we have a good manufacturing base, we have a good talent, we have good infrastructure facilities. And with that, most of the state government have now come up and made reforms for the labor have been changed. It's now user friendly. It's now the industry which they can have the ease of operations. So most of the labor laws, because India was always, people used to have before investing, the labor laws was the major challenge in India. But now most of the state government have changed the labor laws to attract the new investors. Now some of the good HR practices in India done by the various industries like FMCG, Hindustan Lever, Nestle, Hindustan Coca-Cola Beverages, Samsung, Whirlpool, LG, what they did that they increased the salary and they increased the bonus. So the people whose morale was down, with such kind of activity, their morale has really boosted up. The companies like Myco, Bosch, they have signed the wage settlement agreement in this kind of a period with giving the rise of 10,000 rupees per month. They also made the permanent 230 of the trainee which they have as a permanent workman. Companies like Tata, which is known for their welfare activity and the caring nature, they have given a certain amount of advance to all of their vendors. So their cash flow can be eased, and they said that we will start recovery in installment after June. So that was a very, very big boost for all the vendors, whether it's small, big, for all the vendors. Tata has taken such kind of initiative. Organization like Bajaj Electrical, what they said that the employee who's having their kid 5 years and below, they can work from home. Even after the post-COVID situation, they can take that liberty and they can work from home. Some of the IT companies, they state that they can extend the work from home till 1st August 2020. Organization like Goenka RPG Group, they have engaged the services of doctors, psychiatrists, nutritionists to take care of their employee and to their family. Axis Bank, they have started the virtual meditation service sessions, online learning modules. Then we have All India Council of Technical Education is one of the topmost education regulatory body. They have developed the various courses, online courses, free of cost program. Since we are facing through a lockdown situation, the people and the student could get benefit out of it. Similarly, each and every organization trying to take care for their employees and customer with out-of-box activity, because this is a time where you should do something out of box, and most of the industries are doing that. Now, what is the HR aspect? What kind of a thing HR will have in future after this post-COVID? It will have a tough and challenging job. All the pressure will come on the HR for cost cutting, for reducing of manpower, retaining talent, multitasking, extending working hours, and without paying extra cost, reduction in salary, freezing the promotions and increment. HR profession will have to identify alternate employment options considering the cost cutting aspect, which is like that fixed term employment, apprenticeship program, gig employment. Going ahead, we feel in India, the HR professional will have to face the IR issues after a certain period. As in India, there are states who doesn't have the manufacturing setup or the industrial setup, their people go and work for the other states. We call it as migrant labor. And with this present situation, all the migrant laborers have gone back to their hometown. They have faced very difficult situation. Now, when they went back, they are into the 14 days of isolation period. So we don't expect these migrant workers now to come at least 5 to 6 months to work back, and the industry will hamper. So the industry will have to develop the local people. They have to engage the local people. And one of the fear which is coming, that the local people will take definitely a disadvantage after a certain period, asking for the more revenue, asking for the more salary, more benefits, and the union will try to take this kind of a situation advantage, and we expect some IR issues to be developed in some of the part where it is IR proven areas. Managing work from home comparatively being a new concept, though it was earlier people used to do, but as by and large it is a new concept. So HR professional will have to have the major challenge how to manage that kind of activity. Implementation of various government guidelines post-COVID, such as social distancing, sanitizing, wearing of masks, avoiding face-to-face meetings, managing social distance in transport and canteen. This everything will have to done through the HR only. So I think this is one of the major challenge they will have. Organizing online training sessions. The recruitment pattern will totally change. We used to have always the face-to-face interviews and recruitment. It will totally change. Onboarding process will also change. To implement management expectations, it will be a huge challenge for the HR professional, and they will have to go tremendous work stress. Overall, post-COVID-19, HR function will be most stressful and challenging function. It will be a real test for HR professional to overcome of this. I feel that now at the COVID situation, we have doctors, healthcare workers and other things, we call them as the COVID warriors. But post COVID, I think HR professional will be called as a COVID warriors. Thanks. Thank you very much.
Thank you, Vishesh. I like your final phrase, post-COVID warriors. So new designation for people practitioners, because it has to be a people-centric era, because people come to the forefront. So post-COVID warriors will be people professionals, HR professionals. I like the way you stress that with suitable examples from India. Thank you. So may I now turn to my friend from Singapore, Mr. Eddie Lee. Eddie, it's over to you to talk about Singaporean scenario with the emphasis on human resource practicing challenges.
Okay, hi everybody. Thank you for inviting me to speak on this event. I'm going to share a slide. Okay, so I basically just want to share quickly on the Singapore update, and I will touch a little bit about what are some of the initiatives that Singapore is doing. So if you look at it, interestingly, the total number of cases as of yesterday is 21,707. And if we talk about the active cases, when we talk about active cases, we are talking about 18,402 of them are in isolation, meaning that they are in some of the isolation facilities. It could be in hotels, it could be in some other facilities that the government has set up, temporary set up. Then, if you really look at the people that are in the hospital, so talk about general ward is about 1,200 people, and then in ICU is about 22 people. And then you talk about the number of death cases is 20 cases. So looking at this number, we are actually not too shocked about the number, because majority of the numbers are actually people from the who are the foreign workers working in Singapore. So we are actually right now in the second wave of the COVID-19. The first wave, we were very much focusing on the Singaporean, the PR, those people, foreign expatriates working in Singapore. So we actually pretty much have well contained those. Then the next thing is that we focus on those Singaporean or PR returning back from overseas back to Singapore before it actually became a global pandemic. Then what happened is we forgot about a group of people. I think it's something that we came to realize because of the unique how Singapore is being structured, and Singapore is a very small country. So knowing that, meaning that we have very limited space and land. And talking about that, it means that a lot of our foreign workers, they do not have the luxury of big countries whereby they can stay in places whereby there are sufficient spaces. So in Singapore, we have a large pool of foreign workers in Singapore, and a lot of them are staying in dormitories. And in the dormitories, there could be a lot of people actually staying in one room. So when one person actually got the COVID, he actually very much easily infect the rest of the people in the same dormitory on the same floor. So this is actually one learning that we have learned from this COVID thing. Right now we are paying a lot of attention, and if you look at the statistic right now that is being shown, majority, I would say about more than 90% of them are really the foreign worker group of people. And we are actually speculating to end of the month, we could hit up to 40,000 cases, which also majority of them are really from the foreign workers. The rest of the people, like example the Singaporean, the PR, the numbers are maintained within 20 per day, so it's still relatively small. So when I look at the whole situation, there's quite a number of business people and also a HR practitioner actually asked me, how do I feel about that? I think first comment I will make is that I'm pretty happy that the Singapore government is very transparent from the start of the whole situation. So we don't cover any numbers. We actually come up front with the numbers, and it's very much documented and announced every day of the cases. So they provide daily updates and also what are the things that we are putting in place. So I think the Singapore government has done this part whereby it actually won a lot of praises from other countries about us being very transparent. We are not very concerned about how the number will impact us on the world stage, how the world stage view us. But it's really about being looking at how do we take care of our citizens and also people working in Singapore, including the foreign workers. So this is some of the things that we are working very hard on that. So the next thing is that looking at the situation, we actually started quite early, all the way in February, that we actually talk about the different budgets. So in total, the government has put up 3 budgets in a course over 3 months. If you look at the dates, and the total budget is about 60,000 budget, 60,000 billion budget, and it's actually focuses on 3 pillars. One is on families, the next one is on workers and jobs, and the last one is on businesses. So I'm not going to go too much in depth into all this. It's just a summary of some of the things that we have put in place from the different perspectives. So the next one is that I want to talk about the circuit breaker measures. Then of course we talk about in China there is a lockdown. We talk about in other countries where they use the word lockdown. In Singapore we don't really use the word lockdown. We actually call it the circuit breakers or the circuit breaker measures. So it was first implemented on the 7th of April, and then we implemented tighter measures on the 22nd of April. And right now we already this week we already talk about easing some of the measures. And next week, there will be even much more easing of the measure on the businesses. So there are businesses, just I mentioned that there are businesses who ask about us. I think the first thing is about transparency. The next thing is that looking at the statistics, it's better for us to know the situation so that we know how to manage the situation better. So the worst thing is that we do not know what we do not know. So this is something that Singapore approach is that we want to know what we do not know so that we can start to plan for the next thing to do. So talking about the circuit measure, there is a lot of impact on individuals and likewise on businesses and likewise on HR as well. So I just want to, there's a lot of things that the fellow panelists has already shared. I'm not going to go too much in depth in that because I think that they are pretty much common also in Singapore as well. But I also want to highlight one is, which Australia talk a lot about, is the well-being. So I just want to talk about two parts of it. One part of it is really the physical well-being, meaning that the people are not allowed to get out of the people are encouraged to stay at home. So there is no more places in Singapore that you can actually go out to exercise. The gym facility, the park are all closed. You can walk in big open space, but in Singapore, because the space are not really that big, like example, we talk about the parks, when the government say that you can go and exercise in the park, a lot of people start to gather and go to the park. Then, because of that, then the government has to say that no, now from now onwards, you're not allowed to go to the park. So it seems that because of the COVID, everybody seems to get very healthy, okay, by going to the parks, or rather, I'll say that probably this is one of the excuses that they use to go for a social gathering, or at least to meet some humans instead of staying at home. So one of the measures that were put in place, and it's actually a legislative requirement right now, is that about social gathering. So there is no more social gathering more than 2 persons unless you are from the same household. So meaning that I myself, example, I cannot even go and visit my grandparents or my parents in another household because we are from different households right now. So this actually put a lot of strain on individual, meaning that a lot of people are looking at how do they kind of survive at home physically as well. So the good thing is that the Singapore Sports Council has also put a lot of those exercises online. So they actually encourage people to exercise at home with all the videos recording that are made available to the people. So I would say that from a HR perspective, is also how do we encourage our people to stay healthy during this workplace, physically healthy during this period of time. The next one is talking a lot about the mental wellness. I'll say that this is taking a lot of stress on a lot of people. So initially, when a lot of people talk about working from home, I think they're getting very excited because now I can do a lot more things. I can multitask. I can take care of my children at home, and I can do my work. I can wake up later to go to work. But as time goes by, they begin to realize that, hey, there is a big problem. First of all, this staying at home, it doesn't just apply to me, but also apply to my children. Meaning that right now, they don't go to school, but what happens is they still have to do their homework, they still have a lot of assignment to do, and me as a parent, I have to help them to do their work because it's no longer done by the teacher. So I have to juggle with my children's homework and my work. So there's a lot of parents are getting a lot of stress managing their children. So there was a very interesting observation that, when in Asia, we discipline children with canes, or feather duster, and it was actually run out in the market because a lot of parents are buying, not really to use it on the children, but they actually use it to threaten the children to do their homework. So this is a very interesting phenomenon that we have seen in Singapore. Then, we talk a lot about the mental wellness. So I spoke with a lot of the people from the workforce. They are actually getting a lot of stress because they start work earlier because they do not need to travel, so they have to start work earlier. The next thing is that they can forget somebody who says, hey, let's go for lunch together. So as such, they forgot to take regular meals, and also they finish your work even later. So this actually creates a lot more stress. So I have to actually encourage some of them to set alarm clock at home to tell them to remind themselves to go for meals, to take a regular break. So these are some of the things that we are very concerned about for the workforce. So I just want to touch on a little bit that Singapore is really pushing very hard right now. We know that Singapore is actually a very developed country, and we talk a lot about technology. But right now, we are actually talking about how do we leverage technology that enables safe resumption of activities. So as we were talking to this morning, I was reading the news. Quite interestingly, we have already have a robotic dog in the parks to remind people of safe distancing. So we are actually implementing a lot of the robots throughout the whole country, trying to do a lot of things. So using technology. So this is going to change our life a lot. So I spoke with people, how do I really view this COVID situation? Is it a good thing or is it a bad thing? So there's a lot of negative sentiments in the market and also in the workplace. But my advice to a lot of the HR practitioners, my fellow practitioners, and also the business people is that this is actually a very good opportunity for us to change mindsets. The reason why I'm saying is that because while the government is pushing a lot of technology, a lot of businesses, especially the SMEs, are saying that why am I investing in technology and it's going to be a big cost to my company? So the behavior are not changed as quickly as we would like to, but because of this COVID, we have to start to leverage on technology. So I would say that it's really how do we perceive the situation. If we have a negative perception, then we will attract a lot of negative energy, and likewise, we will not have solution. But if we have a positive perspective of things, we will draw a lot of positive energy, and likewise, we will start to see a lot of open opportunities, good opportunities, and solution. So I just want to bring to this group, I don't want to take too much of the time sharing because I'll say that other panelists has already shared a lot of good examples. I really just want to touch on having the right mindset, getting our people to be ready for the future. I would say that one of the things I also observe, and also fellow practitioners also concur with me, is that it seems that sometimes a lot of the employees are depending on the company to plan for their career, to plan for the future, to tell them what are the trainings they need to go to. But I say that this is actually the right time for us to start to educate, to start to create awareness for employees, to start to think about their own future, to have the right mindset to think about the future of work. So this is one of the messages that we are trying to drive to get the employees to own their own career, to start to own how are they going to grow in their own career, how are they going to be more actively finding a solution to become more effective and efficient at their work. So I just want to end off with this. I know that I'm talking a little bit more in general, but I hope that this is something that is supplementary to a lot of what my speakers have shared, and I hope that it's going to be helpful for the discussion today. Back to you.
Yes, thank you, Eddie. Thank you for describing the Singaporean scenario. I like the example of a robotic dog to ensure physical distancing in parks. So, and also the aspect of leveraging technology for the betterment of human beings. So now I'm moving to another South Asian neighbor, Mr. Mohammed Mashruku from Bangladesh. Mashruku, it's up to you to talk about what's happening in Bangladesh from the human resource management point of view. Yes, microphone.
Yeah.
Yes.
Can you hear me?
Yes, please.
As because time is very short, I will concise my deliberation within 5 minutes and for 5 to 6 slides as we have agreed day before yesterday. First of all, dear panelists, our moderator, Professor Ajanta, Mr. Mr. Dhammika, all the APFHRM members, and the viewers who are watching us for the long time. Assalamu alaikum, Ramadan Mubarak, and very good afternoon. And best wishes from HRM. Today's topic is HRM challenges of post-COVID-19. I'll try to concise with the topic and with the time limit. And before starting, I must thankful to APFHRM and CIPM for taking this very nice and time-bound initiative. And I think all the member countries, we will be helpful from this deliberation and from my other fellow panelists. So, why it is not moving? Oh yes. Focus on HR challenges of post-COVID. So, next slide. Why it is not moving? I like to brief you about Bangladesh within 30 seconds, because you will feel that our problems if you look at our demographic data. Our total area is 1,47,570 square meter. Population is 162 million. Density 1186.90 per square kilometer. I think most densely country among us. Total administrative division, we have 8 divisions and 64 districts. We have 12 city corporations. Our life expectancy is 72 years. GDP is 317.465 billion US dollar. GDP ranking is 39 among the World Bank member countries. GDP growth was 8% in 2019, and it is come down slightly in 2020, 7.9%, and we are apprehending that it will further fall down due to Corona and COVID. Our major contributing sectors in GDP is mostly agriculture, foreign expatriate, and R&D sector. Also, other industry sectors are contributing a lot. So, COVID directly affected our foreign expatriate, as most of the countries are under lockdown, and our foreign expatriate are coming back, or their income already stopped. And our agriculturists, they are growing the crops for us, but at this moment, as public transport and all other facilities are not available, they are facing much problem as they are not getting their proper price. So I like to go to next slide. As of yesterday and today also, our Corona crisis started on first death case found on 8 March 2020. I will give two scenarios, 31st March scenario and 8th May scenario. Confirmed cases was 51 on 31st March, and on 8th March 13,134. Recovered was 25, and yesterday till yesterday recovered 2,101. Death was 5 on 31st March and 8 May 2006. Isolated case were 359 on 31st March and 1874. This data is collected from IEDCR, Institute of Epidemiology, Disease Control and Research. This institute is handling all the tests and test results, and they are doing day and night after the COVID-19. And total tests done till yesterday was 1,59,165. Next slide. Okay, now what the challenges we are facing? I just pointed out the key challenges. Review the health and safety, environment policy, and preventive measures. These is one of the greatest challenge for our HR professionals, as many of the industries are now opening after the lockdown, partially opening. So this issue is very much vital for our professionals to maintain, to ensure. Employee relation and welfare. Extension, the word should be extension of group insurance. I mean the amount of group insurance to be enhanced, hospitalization plan, especially COVID affected employees, what they will get the benefit from the institute of government. That is also our biggest HR issue. You know, one of our HRM members already died from the COVID attack. Next challenge is psychological issues of the employee. Our employees become morally upset and demotivated because of their safety, security, and safety of job and salary. And you know, we are passing the Ramadan month, and end of this month, our Eid al-Fitr will be coming, and this is it will be a great celebration. But this time, we may not able to celebrate properly. But during the Ramadan and other Eid festival and other festival, all the employees get bonus, but this time all of them are afraid of that, whether they will get bonus or salary or not. Proper employee management, employer communication, employee management and employer communication. It's a big issue. That is, frequently government circulations and orders are passing out, and the employer and management are giving orders, and all the after declaring the holidays, most of the employees and workers went to their hometown and home village, and it became very difficult to communicate properly. Another problem, another risk is risk management based on assessment, risk assessment, and absence of risk management fund. We have no risk management fund of the companies or government. That's why our companies are facing liquidity problem, even to pay the salary and wages, though our government announced the incentive packages. I will give later on. Flexible office arrangement, office from home arrangement, these to manage these also a challenge for our HR professionals. Cost effectiveness and cost benefit analysis. Most of the companies, not only in Bangladesh, I think all other companies are trying to, when question of cost reduction come, they try to reduce the salary or reduce the human resources. And we are also facing these challenges. And legal and compliance issues, particularly in Bangladesh, we have Bangladesh Labor Act 2006, and we have Export Processing June Acts for the private employees. Government employees are almost covered because they are under government service rules and they have benefits. But in Bangladesh, 95% employees are from private employees, private companies. So especially R&D sectors and apparels and also SME, they are facing a lot of problems, especially legally and compliance issues. And sustainability and continuity of the business is a big issue for HR, as because HR is the bridging point of employer and employees, and they are frontline employees of our government. Next slide. Yes. In spite of our lot of challenges, I personally always optimistic, and I believe all challenges have some opportunities, and as HR professional, we have to grab these opportunities. To me, first opportunities in the Bangladesh perspective, our government, especially our Honorable Prime Minister Sheikh Hasina, constantly monitoring and supporting in sustaining and continuing of economy and businesses. Honorable Prime Minister has granted incentive for different sectors, 1 lakh crore rupees already announced for different sectors, especially for paying the wages to the workers, blue collar employees. And also our government has declared interest-free waiver of interest from the loan for 2 months. And in Bangladesh, we have 162 million people, and we shall be able to utilize them as our people, if we transform our people to new competency to be required, which already Ajanta and Julia said that we have to upskilling, reskilling, and multi-skilling our human resources. And we have to do it. And this is also our opportunities, as we have 162 million people, and 65% of them are young, energetic, and they are working and able to work all over the world and in Bangladesh also. Our R&D, apparel and textile and other sectors are very much capable to export their products to other countries, and post-COVID, definitely there will be a good market again. Our HR, other cross-functional departments and employees are very conversant, be more competent to survive and continuity of business. Because of COVID, they are exploring new dimensions of their competencies. They are looking forward to Industry 4.0 and other machine and technology in same platform. So we are hoping that it will be beneficial for us. We'll revisit the HR policy. By revisiting the HR policy, we will be more workable and more productive, our HR people and our all other cross-functional people.
Yes.
Our people will be more empathic, practical oriented, and will accept the changes. Because of challenging the COVID, all the human beings are being again humanitarian, and they get back the quality of be human. I always said that to be human resource professionals, first of all, we have to be a good human being. And now time comes that we should be good human beings. All will be more progressive for these challenges. Next slide. I'm almost at the end of my presentation. And my message to all my Bangladeshi and other professionals, HR professionals, that don't give up, be with your employee, don't cut salary or lay off during this period. Think the people who made your companies. Our entrepreneurs should realize that the people, they have made the companies. So during this crisis period, we should not leave our people. Establish employee rights, worker and non-workers, pay incentive and both workers and non-workers, comply the legal and compliance issues as well as updated rights, and obviously human rights and ILO conventions like that. Next slide, I think last slide. Trust your HR and other employees. Keep HR in front line as your best wellness. This is to our employers. My appeal to employers: ensure PPE, occupational health and safety, as because it will be, I think it will be required for further 2 or 3 years maybe, unless vaccination or any protective medicine or vaccine be invented. We all should make positive plan, policy, and notify employees properly. Take all effort to keep your people with you. Effort is not enough. We have to make it happen. My last message to all: take care, be safe, and blessed. Thank you all for hearing me, and thank you again, Professor Ajanta, my dear friend Dhamika, and dear friends, dear panelists, for hearing me and for arranging this such type of great session. Thank you all.
Thank you, Mashiko. Yeah. Thank you, Mashiko, for wonderful ways of describing the Bangladeshi situation. Now, I have kept the best for the last. This is Dennis Hartley. I think currently the best case of revival after COVID-19 is coming from New Zealand. So we have lots of new things to learn from New Zealand. So Dennis, you are patiently waiting to hear all of us. Now let's get some insight with your dynamic leader, Jacinta Ardern. I'm sure you'd have done a lot of things. It's not feminine government, I presume. So it's a diversity in action. So Dennis, up to you to talk about the HR insights with regard to New Zealand scenario.
Thank you. Well, I have to say, after having listened to Rosie, I think Fiji's doing pretty well as well. So what I want to do is talk about 3 things. Thank you, Rosie. 3 things, very brief scenario of our country's situation. And then I'm going to focus on HR challenges from 2 perspectives. Firstly, the feedback from our HRMZ members going into the COVID management. And secondly, the most recent survey we've had from our members around how they're preparing to come out of alert level 3 and what their thinking is around that. So in terms of the country's situation, we've had 1,492 cases. And of those, we've had 1,368 that have recovered. Unfortunately, we've had 21 deaths, and as I phrase it, that's 21 too many. Our daily cases have dropped from a daily high of 86 down to, we're averaging between 0 and 2 cases a day. When I look at this through HR change management lens, one of the things I talk to people about is not declaring victory too soon, because this is a long haul for us, and we expect it to keep doing this before it tails out. I think, picking up on your comments, we're incredibly grateful to our government, certainly our Prime Minister Jacinda Ardern and her government, who took very quick decisive action in what they called their go hard, go fast strategy. And they have navigated us as a nation through this journey of, first of all, hearing about COVID to where we are now in level 3 as we prepare to come out and potentially go into level 2. So where we are right now is we have had 4 weeks at level 4. We've had 2 weeks at what we call alert level 3, although many people in New Zealand would say it was level 3.999. There wasn't that much of a shift, but I think it was the right thing to do. We are waiting to hear on Monday, similar to Australia, as to what the next steps will be. It will be either we'll go to alert level 2, but we see that being as reconfigured from what it was prior to us coming into the lockdown period, or our previous level 2. We see it as being quite phased, a phased level 2, bringing on some services and businesses before others. And I think they're going to be keeping a very close eye on, you know, what emerges as we go through this level 2. In terms of the impact on our country, it's had significant impact in certain sectors, for instance, tourism, hospitality, the same as some other countries have shared. And certainly in the last week, we have had some very, I suppose, legendary or well-known hotels that have had to say, actually, we're now closing. You know, these are ones that have been around for generations. Employment. So in Q2 of this year, employment was tracking at about 3.9%, which was a low, an 11-year low. And just in this third quarter, it's gone up to 4.2%, which on the face of it still seems relatively low. However, scenario planning has suggested that without a government recovery package, unemployment could go between 17 and 26%. With government intervention, it's suggested that it will be round about 13%. Now, we need to contrast that against what we had in the GFC, the global financial crisis of 2008. And at that point, our unemployment was 8.5%. So a difference between 8.5% and 13% is quite significant. But our government is working currently in stages of planning around putting in place a recovery strategy, and what that looks like at present is unclear. What has been good is our government put in place quite early on a employer package which supported employers to keep their people in employment for 12 weeks. And that comes to a close round about the 18th of June. So that gives the high level country scenario. If we look at GDP, it's suggested that New Zealand, it'll be 2024 before New Zealand will return to current levels of GDP. So it's a long haul for us, as we've heard many countries talking today saying the same for them. So if we look at HRM challenges, I'm going to look at the challenges going into COVID and the challenges as we prepare to move forward. So as many of you have shared, you know, HR professionals have really taken a front and center role in supporting their organizations to rapidly adapt and to adapt to a virtual world. And I remember being with a group of what I call developing HR professionals in the first week of our lockdown. And the pluses they were talking about were well, the stuff we've been talking about for ages that we wanted to get on the table, such as remote working, and was always too hard, now it's happened pretty much overnight. So there were some pluses there. But the challenges at that time, we surveyed our members and we asked them, you know, what are the challenges that you're experiencing? And they reported that they were navigating challenges that they had never encountered before. And, you know, I put that into context and think about it's challenges that we don't have in our professional toolkit to draw upon. So it was them reaching out to others within their network to understand, this is our situation, how are you looking at it? Another key challenge or concern, primary concern, was around the health and safety and wellness of their staff, and that was paramount importance. That came out quite clearly. The challenges of managing remote workers, we've heard others talk about. You know, for many people leaders, this was the first time that they had to manage remote virtual teams, and that in itself is a different skill set. Equally, the adapting, or organizations having to adapt very quickly, employee remuneration and hours of work to adapt to what's happening. Some pluses, or I've heard, you know, organizations talk about some of their learnings. They said, they talked about redeploying parts of their workforce. So for the larger organizations that were able to redeploy, they have actually found some benefits in that through redeploying people from certain parts of the business, they're actually building workforce capability and flexibility for the future. And this has been a real learning opportunity for them. And they've been talking about how do we keep that going. In those organizations where HR had a voice and was part of decision making, they came up with the more creative solutions, which were firmly focused on retaining people instead of potentially stepping straight into redundancies. And we did see in the first few days of going into level 3, some organizations going straight into a redundancy process. So those organizations where you had HR either at the top table or as part of that decision making, they were much more creative in their solutions. And it's likely that we're going to see those organizations that have worked to retain people accelerating their growth and retaining their people in the next 12 to 18 months. So what about the future challenges? Well, we know that our post-pandemic workplace is going to be vastly different from before. Medium term, we see it as being a mixed model of remote working and physical working in offices with physical distancing measures in place. So last week, we surveyed our members and we asked them, you know, what are your thoughts and your challenges? How are you preparing to move into alert level 2? And there were some interesting results. 70% of our respondents identified the health and safety of staff as the key driver in their decision making. Interesting, getting back to business as usual, so business as usual at alert level 2 was only a secondary concern. Just about 50% of businesses are planning a very phased approach to returning to work, with a focus on actually keeping people away from the workplace as much as possible. And the view is that if employees can continue to work from home at alert level 2, then they should continue to do that. Our respondents also talked about a very mixed approach to returning to work, and it was based on a range of different considerations. So for instance, staff roles. Is it possible for that person to work effectively remotely? If not, they may need to come into the office. What's the number of the people in the workplace? So for instance, where the number's quite low and you have more space, then physical distancing is easier. Where the numbers are higher and you're working, say, in open plan offices where you're closer, then I've come across organizations that are doing rotating. So either rotating 1 day on, 1 day at home, 1 day in the office, 1 day at home, or 1 week in the office, 1 week at home, are the primary consideration around that physical distancing. Other concerns were around underlying health issues for individual staff, so what we call vulnerable people, and associated risk factors for them or those in their bubbles. Also taking into account individual preferences of staff members. And, you know, I heard Eddie talking about all the positives that have come out for people in terms of remote working. I think there's been pros and cons for people in this time. Also, our members talked about the need to look at protocols for shared spaces. So for instance, how they use in offices, meeting rooms, what are the protocols around that? What about our kitchens? You know, the very basic stuff. What about bathroom facilities? Protocols around that. And, you know, hygiene measures as well. So that gives a very high level picture. What was quite interesting when I was doing some research around this, New Zealand's scenario modeling initially worked from what they call worst case scenario. And worst case scenario was 6 months at level 4 and 6 months at level 3. And best case scenario was currently what we're working to, which was about 4 to 5 weeks at level 4, and then coming to level 3 and phasing down from there. In summing up, you know, my view, I say my view, working as an HR professional, what can HR teams do differently? Well, for larger teams, I'd be looking at trying to separate or to split the HR expertise into 2 areas. One would be the transactional stuff, the HR transactional, which was the pay, the leave, all the stuff, the day-to-day stuff that we do. And secondly, the transformational arm. So having people work on the transformational, which is that future focus. And it's that thinking that is going to help take their organizations forward and really accelerate growth when we come out at the other side. My sense is that HR has a future vital role, and I call them workplace architects. Workplace architects around reimagining and rebuilding a workplace that provides the employee experience that attracts and keeps the best people and helps their organization not initially just to survive, but also to thrive. So that captures my thinking. Thank you.
Thank you, Dennis, for that delightful descriptive response. And in fact, I didn't realize that we have already spent more than 2 hours, but still the participation, still the enthusiastic engagement is amazing. So that shows the power of knowledge sharing across the Asia Pacific region. So I was going through the questions posted by the participants, and some of them had been replied by the text message, but I think most of them had been addressed by now. So let me straight come to the final round, 1 sentence response. So what is your message for HR professionals in the region? So let me begin with Mr. Arisandan Naidu. Ari, what is your 1 sentence message, 1 sentence, 30-second message for the HR professionals in the post-COVID-19 pandemic?
Be prepared, be more aware, and look for changes.
Thank you. And let me ask the same question from Rosemary. Rosemary, I know it's rather late in Australia, but thank you for bearing with us. So what's your 30-second, 1 sentence response?
HR professionals need to be here for the long haul and need to manage their own wellness.
Thank you. So let me turn to Mr. Vishwesh from India. Vishwesh, what's your advice to HR professionals?
The post-COVID situation has given the opportunity for HR professionals to show what they are, and I think we should grab this opportunity.
Thank you. So let me turn to Mrs. Rosie Fong. Rosie, what's your advice?
For HR practitioners to be more engaged, to also communicate with the workers, and please put the workers' welfare, health, and well-being as something that we should, in this present moment, be for our people.
Thank you. So let me ask the same question from Eddie. Eddie, what's your advice?
My advice is that HR practitioner, you are the bridge between the company and the employees and the workers. So most important thing is to communicate to both sides, make sure that there's alignment and there's buy-in from both sides.
Okay. So let me turn to Mr. Mashruka. So Mr. Mashruka, what's your advice? Yes, I think your microphone. Yes, unmute the mic. Yes, please. So what's your 30-second advice? Yes.
Am I audible?
Yes, yes, can hear. Yes.
Okay. I think we should be passionate. We don't give up. Proper communicate with the employees, employers, and the stakeholders community. We should be change agent. We should be taking the risk, and we should be aligned with the business.
Okay, thank you. So let me turn to Dennis once again. Dennis, what is your 30-second, one-sentence advice?
Okay, one sentence. Picking up what I said, ensure that HR has a voice going forward, because you'll get sound decision making from there. Stay well, look after yourselves, and don't feel that you've got to have the answers to everything. Reach out into your network if you're dealing with stuff that you've never encountered before.
Okay, so let me now turn to the President-elect, Mr. Dhammika Fernando. I'll give you 45 seconds to conclude. So what is your 45-second overall advice to the entire Asia-Pacific region?
Thanks, Ajanta, once again. See, as I told you in my presentation, now is the chance. Now, HR been clamoring for that chair at that proverbial table. Grab it, and you will be, in the short term, the frontline people in the battling of COVID aftermath. As I think Vishwesh mentioned, they will be the post-COVID heroes. And the single sentence advice, or the thing that I would leave with the HR fraternity is with these last words which I mentioned in my slide. That is like a prayer: agility, adaptability, resilience, communication, and empathy. Thank you, Ajanta.
Thank you. In fact, we are experiencing the VUCA world in our doorsteps: volatility, uncertainty, complexity, and ambiguity. So what we need as HR community, HR professionals, people, practitioners, is to move from VUCA 1.0 to VUCA 2.0. Vision, understanding, we use then the confidence and agility. Vision, understanding, confidence, and agility. With that, we need to work with people, we need to work for people, and we need to together achieve the results. From survival to success, the transformation has to be led by people, and HR professionals are the post-pandemic warriors, as we rightly understood, we rightly identified. And let's show our value addition, our value creation to the respective organizations and to the society at large. So may the world will be a more eco-friendly, better place to live. All the very best. May all beings be healthy, happy, and satisfied. So this is the way to conclude this wonderful webinar. Thank you very much for being with us. Thank you, my fellow panelists. So this is a cross-section of the population around the globe. And thank you, my dear CIPM IT team and Himali and the Secretariat. And thank you, Dhammika, for your inspirational guidance for us. And thank you, everyone. So let's reflect, refresh, and relate, in taking something meaningfully back to our workplace, back to our society, back to people, and then improve and ensure that we do something better for the humanity. Thank you so much and wish you good luck. All the very best.
Thank you. Stay well.
Thank you.
Good night.
All the best.
Bye-bye.
Yeah.